First, I would like to thank AACR for the opportunity for exhibitors to give this Spotlight webinar, and to all of you being interested in this webinar. In this session, I would like to talk about testing of new drug candidates in especially syngeneic animal models. In particular, I would like to address common issues scientists experience when testing the efficacy of new drugs in mouse models. I start the presentation by describing three common problems that occur in efficacy studies testing new drug candidates in tumor-bearing mice. The problems can occur when using standard cell lines such as B16 or CD26 after subcutaneous implantation into the flank of mice. Here is an example of a study of a B16 tumor model. You can see the growth of the tumors in the individual mice after transplantation. Many mice were culled around day 13 after implantation, long before all mice could develop decent-sized tumors. We ideally look for tumors around or larger than 2,000 cubic millimeters. We had to terminate these mice because the skin at the tumor site was ulcerating. This study would not have given us enough mice to make a meaningful endpoint analysis in an actual efficacy study. In this example here, the tumors grew to sizes between 200 and 2,000 cubic millimeters. With such heterogeneous tumor growth, it is very difficult to compare treated versus non-treated groups with statistically significant results. The next most common issue many scientists face is that the cell line they would like to use for in vivo studies does not grow well. As you see here in this graph, the tumor growth doesn't take off. This is particularly frustrating if there is a cell line that checks all of your requirements in regards of target expression and potency, and that you may have used extensively in your cell-based studies. How can we overcome these issues? I would like to introduce myself. My name is Holger Weber. I'm at the head of the immune pharmacology department of reaction biology. We are a contract research organization since 20 years and have performed several thousand animal studies to test the efficacy of new cancer drugs in mice. We have faced this issue I just showed you many times. We realized that the major factor contributing to unsatisfactory study outcomes was ulceration. Let me briefly explain what it is. After subcutaneous implantation of tumor cells, the tumor starts growing. The skin at the site of tumor gets inflamed and less supplied with blood and eventually breaks open. When tumor ulceration in animal studies occurs, these animals have to be euthanized because of ethical reasons. We tried to overcome the ulceration problem by implanting the tumors at a different site. Notably, tumors of our orthotopic breast cancer models were growing with no ulceration issues, which led us to try mammary fat pad injection with other tumor types. The results were surprising and very impressive. Here's the example of the B16 colon tumor model. In blue, you see the graph that I showed you earlier, with all of these mice dropping out to the study due to ulceration. When we implant the tumor cells into the mammary fat pad, the results are stunningly different. As you can see in the red curve, all tumors grow above 2,000 cubic millimeter and they grow beautiful homogeneous. We named the implantation method SubQperior, since the technique is very similar as subcutaneous implantation, however with superior results. How does the ulceration issue resolve in other tumor models? Ulceration is an inflammation of the skin at the tumor site and is mostly an issue in syngeneic models. We have counted the animals that experience early termination due to ulceration issues for a variety of syngeneic models. You can see in purple the fraction of animals which had to be euthanized because of tumor ulceration and not because of tumor volume, and therefore drop out earlier in the potential efficacy study. When, in contrast, we count the animals with ulcers after SubQperior implantation, the picture is very different. We see almost no animals that have to be culled because of ulcers. So these animals grow tumors until they reach the maximum tumor volume specified by our regulatory bodies. I would like to show you how the implantation site looks histologically. The mammary fat pad is between the tumor and the skin. We think the mammary fat pad serves as a buffer zone to keep inflammatory effects away from the skin, thus preventing ulceration. In addition, and very importantly, the tumors growing in the subdermal cavity are very spherical inside the tumor capsula, whereas tumor cells implanted in the mammary fat pad grow within tissue, experiencing stromal cell contact and grow more naturally. Since tumors in patients usually do not grow in cavities, but within tissues as well. Tumor implantation into the mammary fat pad is not new. We do this for 20 years for our orthotopic breast cancer models. So why is this different? Because we do not limit this method to breast cancer, but use it for all cancer types. Let's get back to other problems that I showed you in the beginning. Here's the graph again with the heterogeneous tumor growth. The same cell line implanted SubQperior results in tumors that grow to 2000 cubic millimeter and above, which is what we are looking for to get decent results when testing the efficacy of new drugs to decrease tumor growth. Lastly, here's the tumor that did not grow in mice, HEPA-1/6. As you can see, there's tumor growth with SubQperior implantation. It's not the most homogeneous growth curve, but considering that there was absolutely no growth with subcutaneous implantation, that looks promising. I would like to briefly summarize the results that I presented so far. SubQperior tumor models are based on tumor cell implantation into the mammary fat pad. This alternative implantation method results in larger tumors and homogeneous tumor growth, which increase the statistical significance of test results. Also, the take rate is much improved, which allows a reduction of the number of mice we need for our studies. When we present results of our SubQperior tumor models, we are often asked if the response to immune checkpoint inhibitors is comparable to subcutaneous models. To answer this question, we compared the response to immune checkpoint inhibitors, blocking the PD-1 and CTLA-4 signaling. Here you can see the results for CD26 and CD38, as well as Louis Lung. In blue is vehicle control. The purple curves show the efficacy of anti-PD-1 treatment, and the green curves show tumor volumes of mice treated with anti-CTLA-4. Comparing the response in subcutaneous and SubQperior models, we didn't find a notable difference. We also looked at the immune infiltrate of the SubQperior models with our all-in-one antibody panel for flow cytometry analysis. The panel consists of markers detecting lymphoid cells, including various T-cell populations, E cells and NK cells, and myeloid cells such as dendritic cells, macrophages, and MDSCs. Looking at the overall amount of immune cells in the tumors, we made an interesting observation when comparing subcutaneous, SubQperior, and orthotopic implantation. The graphs below show the example of CD26 wild type. Notably, early after the tumor implantation, a high number of leukocytes infiltrated the tumor. The level of immune cells at day 7 and 10 is comparable to the orthotopic CD26 tumors growing in the colon of the mice. This makes us believe that the SubQperior models have some of the desired properties of orthotopic models, which may be due to the cells growing in tissue with stromal contact, as opposed to the spheric isolated growth of subcutaneous tumors. I briefly want to point out that we created immune profiles for all of our models. So if you are interested in seeing which immune cells frequent the tumors, you're welcome to inquire for the data. For proper selection of the most suitable tumor model for your studies, we can offer a TMA including all SubQperior tumor models. TMAs are collections of tumor material on one slide for easy comparison because they are all stained at the same time. The TMAs enable testing of the expression level of target proteins, functional readouts for pharmacodynamic studies, and insight into the immune infiltrate on a single cell level. Very powerful. To conclude this webinar, I would like to briefly list the models that we have so far established as SubQperior models covering the most commonly used syngeneic tumor models. I would like to mention our SubQperior panel screen. Regularly, we perform projects for compound screening on 8 tumor models. We share the vehicle and the immune checkpoint control arm with you for no cost, which makes this an incredibly cost-efficient way in testing your compound on a variety of tumor entities. The extensive characterization that we have done on our SubQperior models helps you to make an informed approach in choosing the right model to address your research questions. Thank you for your attention. Any questions that we cannot address in the following Q&A session can be sent to requests@reactionbiology.com, and I will be happy to continue the conversation with you.